Hi, everyone. Thank you for joining us for this session on the Radiology Concierge Service. My name is Reed Humphrey. I'm the Vice President of Technology Consulting for Canopy Partners. I'm joined today by my colleague, Laurie Shoaf. Laurie is our Radiology Concierge Services Manager. And we're going to discuss an innovative program that can help your practice improve productivity and efficiency. We've designed this to be an interactive session and have built in several different breakpoints to poll the audience and field questions. So hopefully you'll find it to be engaging. We'll try to keep it moving fast. And with that, let's get started. So our learning objectives today, we actually have a few of them. We want to define the problem and solution. Why is there a need for a concierge program within a radiology practice? We want to explain what a concierge program is and help kind of coach on how to build one. We'll discuss the people, the systems, and the processes required. We'll walk through a case study and talk about a few other examples of practices that are using this type of service. And then we'll talk about the results. We'll show some metrics and kind of before and after performance. Then we'll open it up to some Q&A, and hopefully this will spark some good conversation. So again, appreciate everybody joining us. As far as just defining a concierge service, this may be a term that is not familiar to some of you. We call this a radiology concierge service. It's a program that is designed to help take administrative tasks off of a radiologist so that they can be more productive and spend more time reading exams. It's been proven in a number of cases to improve radiologist productivity by 5 to 10%, saving a rad on average between 3 to 6 minutes per hour. And perhaps even more importantly, it helps improve the quality of care within the technologist and referring physician community and with patients by getting the right study to the right rad at the right time. So in this session, we're going to explain a little bit more about the service and how it might benefit your practice. So again, a concierge service, it's an outsourced call center for supporting radiologists in various communication and administrative tasks that impact their workflow. The basic problem we're trying to solve is that radiologists spend a lot of time dealing with administrative and compliance burdens on rads. They're asked to have to do more with less. The demands of the job just seem to kind of grow year by year. They have to serve multiple customers, the hospitals, referring physicians, patients, technologists, have to provide increasing levels of clinical documentation for MIPS and MACRA, clinical decision support, etc. And there are just frequent interruptions and distractions to the job. So based on demand from radiologists, we have worked to put together a concierge program, and you could do the same within your practice. There's nothing proprietary about it, but it's just a best practice. And the solution that we try to come up with is one that can free up the rads so that they can focus on the top of their license. A radiologist should always be asking themselves, what is the highest and best use of my time right now? And this program helps them to focus on that. I'm sure many of you probably remember the famous Stephen Covey story about putting the big rocks first. If you're not, it's a great visual, and you could find it on YouTube. It'd probably take 5 or 10 minutes to watch it. I'll just distill it down to about 30 seconds. Here are two jars that are the exact same amount of sand and rocks in them. But if you put the big rocks in first, the sand will fill in around the big rocks, and you have enough time to get all the things done that you need to do in the course of the day without anything spilling over. But if you put the sand in first, then there's not enough space to get the big rocks in, and important things may get left out in the course of your day. So what we're trying to do with the concierge program is to help the radiologist put the big rocks in first and focus on the big rocks, and then let others handle the administrative and clerical functions. So that's kind of a visual of this program. So I told you we were going to take a couple of interactive polls. So this is the first flash poll. And the question we have is, how many of you have a service like this in place for your radiologist? Please use the chat feature inside of the window here and just respond yes or no. And as you're doing that, Laurie and I will also try to take a few questions, and we have some staff that are helping us field questions as well. So if you'll use the chat window, if you'll just respond yes or no to this question to let us know, if you are using a service like this today, and also feel free to shoot us any questions, and we'll be responding those to you as quickly as we can throughout the session. Okay, so with that, we'll move on. We also want to talk about a case study. This is a case study between Greensboro Radiology and Cone Health, two organizations that are having great success with the Radiology Concierge Service. GR, as they're known, and Cone Health are based in central North Carolina in the Greensboro area. The two organizations have worked together to build this program and have used the service for several years. It's resulted in measurable improvements in operational efficiency and radiology satisfaction scores from patients, technologists, and referring physicians. So we're going to talk about the program that they have in place and just use this as an example. A little bit about Cone Health. Cone is a 1,300-bed regional health system that has more than 100 locations, including 5 hospitals, 3 ambulatory care centers, and 3 outpatient surgery centers. They also have nearly 150 physician practice sites. Cone Health across their health system performs approximately 700,000 radiology exams per year, of which Greensboro reads all of those. And then on the practice side, Greensboro Radiology has 75 radiologists, 5 PAs. The group as a whole reads 1.1 million annual studies, and they serve 10 hospitals and 50 plus additional sites. It's a very innovative, highly subspecialized group that's ranked in the 99th percentile nationally in referring physician satisfaction scores. So between Cone and Greensboro Radiology, we've helped to create this concierge program. And the two main ingredients of this program are the technology side of it and then the call center side. On the technology side, the main product that we use is a smart work list. We happen to like the Clario smart work list, but there are certainly other work list products out there. Some practices have even developed their own. But you really need to have a smart work list that lays over all of your PACS and voice rec systems so that you can see everything in one place at one time. And then we connect that with our what we call our professional radiology assistants, or PRAs, and these are the trained staff members that take these calls off of the shoulders of the radiologist and keep things moving forward for them. So having the technology plus the human capital behind this is what really makes the program work well. And we like to say it's kind of like a Reese's cup. It's if you take the chocolate plus the peanut butter, you put them together, you've got something even better. And then if you do it right, you may even get some Reese's Pieces mixed inside too, that spice it up even a little bit more. So we think that we've kind of taken the best of the technology and the services to build this type of a program. The key components, I mentioned the Clario Smart Work List, I mentioned the PRA staff. You also have to have a pretty robust call center operations. You've got to take a look at your phone systems and the ways in which you're going to communicate. You've got to obviously be able to connect into the facility-based PACS and VR systems, be able to access scheduling software so that you can see which physicians are working at a given time. You have to have comm note tracking capabilities, as well as instant messaging capabilities, which we found to be very, very helpful to be able to quickly get messages and feedback from radiologists. So these are some of the key components of the concierge service. So Laurie is our Radiology Concierge Services Manager, and she actually has built and leads the team of PRAs. So Laurie, I thought that you could, if you wouldn't mind, if you could just share with us a little bit about the team and what they do, and what are some of the value points that we're offering for the radiologist. We kind of view the PRAs as the secret weapon that allows the radiologist to practice at the top of their license. So Laurie, if you could just kind of share with us about your team.
Thanks, Reed. I'd be happy to do that. First, I'd like to touch on a key component of a successful concierge service, and that is a single phone number for customers to contact radiology 24/7. A centralized number minimizes unwanted calls, and disruptions in the reading room, and provides the ability to triage those calls from a variety of sources and ensure timely turnaround. An added benefit is that RADs no longer have to give out their personal cell phone numbers. And this single point of contact for internal and external communication provides a number of benefits. For the RADs, it reduces interruptions, which could include both calls and visits by text. It offloads the non-clinical work tasks and allows a RAD to maintain a clinical focus throughout their day. For techs, it helps improve their operational efficiency as the concierge team does the legwork to facilitate communication with the radiologist. And for referring providers, they benefit by receiving timely report results and then having the ease of connecting with the right RAD. So the best practice for a single point of contact is to publish this number everywhere, internally and externally, and remove all other published contact numbers. Now I'd like to talk a little bit about the scope of services and the tasks performed by the concierge team. They can really be rolled up into 4 categories, which we'll talk about here. But keep in mind that tasks can vary from one practice to another. So not all practices will have the same menu of services. The first one is results communication. This primarily includes critical finding notification, so the PRA can connect the RAD directly with the referring or ordering provider. Handling urgent or non-urgent findings. In this case, the PRA can provide exam findings directly to the ordering provider and document the results of that action. And one key point I'd like to mention here, and we've learned by doing this, is it's very helpful to create a central database of phone numbers to ensure efficiency and have the team have access to that key database. The second component of services involves exam correction and notification. So this is working really in tandem with the techs to assure that corrections are made on exams. This can include missing images, missing worksheets, and other key information. The third category is notification and monitoring. The PRA initiates action in many cases upon contact from a tech, and one of those critical examples is stroke notification. There can also be exam priority escalation so that the exam can be read in a timely manner. PRAs can also assist in just monitoring stat exams in general and monitor those turnaround times, alerting appropriate individuals when those turnaround times fall outside of a standard. And facilitating communication is the last category. And this is answering inbound calls and transferring those calls to the appropriate individual. Examples here include protocol questions and provider consultations. Communication tools that are used, of course, is the telephone, but also instant messaging, as Reed mentioned, a Clario collaboration feature that allows sharing exam information on the RAD screen, and updates to communication notes, which we'll dive into in a few minutes. So a few minutes earlier, I mentioned 24/7, and I'd like to circle back to that for a moment because the concierge service with Greensboro Radiology didn't start out that way. We started out providing weekday service, but that was so successful, we soon looked for a solution to extend to 24/7. This was a tricky challenge and really could be an expensive one too. It's tough to find skilled individuals to work these shifts, and then the potential for turnover is pretty high. So the approach we took was to look offshore. We found a healthcare call center in the Philippines that could provide service to us on the nights and weekends, and this has worked out extremely well. So now we can afford to have a full team of highly trained individuals 24/7. I'd like to share a couple of testimonials with you that really attest to the success of our service. The first one is from one of our radiologists, Dr. Heath McCullough. And he says the concierge service is an absolute game changer. That's a pretty strong comment. And Steve Shannenberger, who's the executive director of imaging for Cone Health, says prior to having a single phone number, it was exasperating for techs and providers to communicate with RADs. And this is just a small sample of the positive feedback that we've received from our customers.
That's great, Laurie. Thanks very much for sharing that. We'll take another quick flash poll here and just ask, does your practice have a single phone number for contacting RADs? A lot of times there may be 100 different phone numbers out there and different ways to communicate the RADs at various locations and also on their cell phone numbers. And as Laurie shared, we believe a best practice is just to take all those numbers off the market and just have one published phone number that everybody uses for radiology. So if you would use the chat feature and just respond yes or no to the question, does your practice have a single phone number for contacting RADs? And also, if you have any questions about this or how to do this, feel free to fire those questions at us and we'll try to respond via chat as well. Okay, so we'll keep things moving. And I'd like to talk a little bit about the Clario Smart Work List that we use. And again, we're not trying to advocate for any particular product. This is just what we've chosen to use. And there are a number of work list products on the market. But we like the Clario Work List product because it functions as kind of the command center for the concierge service. It's a work list that integrates, it can launch cases from multiple PACS systems, reach into multiple archives or VR. So it's meant to be sort of a vendor neutral product that sits on top of whatever you may use across your different facilities. The system provides workload balancing, so it actually allows the radiologist to manage their workload. If you're trying to gauge a radiologist to, let's say, between 50 and 70 work RVUs in a day, you can calibrate it to where that's how many RVUs they read for the day. And if somebody is at a high volume facility, you can shift some of their volume if they're kind of getting crushed on the list and shift that volume to another rad who maybe is having a little bit lighter day. So it allows you to really share the work and balance it around so that people can work effectively. One of the other benefits is that the system allows a radiologist to kind of set their profile in terms of what type of exams they like to read. So if I'm a neuroradiologist, then I'd rather have neuro cases when they're available and then maybe take the general list or other things as they come in, but I want to be fed neuro cases first and foremost. And that helps the practice to also be more subspecialized. So there's a benefit there with the system. It also has some great analytics features, and it has a pretty cool feature that's called Auto Next, which will basically find the next best exam for that rad and serve it up to them. So the rad doesn't have to go hunt the list. You can imagine in a group the size of Greensboro with 75 rads, when everybody's hunting the list, and maybe to some extent they might cherry pick the exams they really want to read, it can create some disparities and maybe even some tension or frustration between the rads. Whereas the system itself can find the next best exam based on that radiologist preferences and assign that exam to him or her so that they can just keep moving, as well as it can escalate if there's a like an SLA that's about to expire. It'll kick that SLA up to the top of the list and say, somebody grab this, so that, you know, people aren't just heads down and miss, you know, the elephant in the room, that there's a critical thing that needs to be tended to. So it's a really great system. It's also a pretty good recruiting tool when practices have this. It's nice to be able to show this to other rads that are considering joining your group. So we like it for a number of reasons, and a number of clients that we've seen out there in the market, and some that are not clients using this product, have reported efficiency gains in the range of 10 to 15% just using this smart work list functionality. So it can really provide a pretty big boost for a practice. So let me just share with you quickly some of the metrics that we've seen with this. In the Greensboro example, turnaround times have improved overall by 35 minutes and 25 seconds since we've implemented this technology. The ED and stat turnarounds have improved by almost 4.5 minutes. The outpatient turnarounds have improved by 32 minutes, which is really significant. The inpatient turnarounds actually gone up slightly, and that's largely because the radiologists were feeling stressed and under the gun with, you know, urgent things, that sometimes they weren't able to spend as much time on the inpatient exams. And so this allowed them to kind of slow down and focus, spend a little bit more time on those inpatient exams. So this was actually a positive direction in the eyes of the physicians. But overall, the improvement in turnaround time using this technology was a little more than 35 minutes. Laurie, if you can kind of show how the actual workflow happens within Clario, that'd be great.
I will be glad to do that. Within Clario, one of the primary communication tools between the radiologist and the concierge team is what we call a communication note, or sometimes we refer to it as a comm note. And this is basically a request for some type of action to be taken. So this slide shows the Clario screen that a rad uses when they're reading an exam. The communication notes feature is integrated into this screen with an icon next to number 1 that you'll see on your screen. The note icon is always available when rad is reading an exam. So at any point in the exam, they're able to click on the icon. They have the ability to quickly identify the type of assistance or action that is needed on that exam, and then choose a specific action from the drop-down selection. So some common action examples are critical results, call reporting, missing images, missing worksheet. And a request can be made with 3 simple clicks. This screen that you see now is what the concierge sees, and we call this a work list dashboard. When a rad creates communication note requests, the note appears on this shared dashboard, and it allows any available team member to promptly pick up the communication note. The work list is set up so it's configurable to allow a practice to customize and prioritize based on their unique needs. Sub-work lists, which are identified in the large red box, provide a hierarchy for the communication notes. In this example, stat cases appear at the top of the list, followed by non-urgent cases, and then exam issues. And this assures that the stat and urgent cases receive priority attention. This slide drills down to an example of a speak to provider non-urgent communication note request. All requests and all action is timestamped within the Clario system with a username and a time. So it's very easy to look in an audit trail of what has occurred with an exam. This example shows an attempted status, which identifies the time a note was picked up by an individual PRA. And it lets other team members know who is working the note, so multiple individuals aren't trying to work the same note at the same time. A completed status is entered when the note is resolved. This removes the note from the dashboard. And there is comprehensive reporting available within Clario, so we're able to easily track turnaround times, completion times, drill down to individual staff productivity to assure that standards are met. This screen shows instant messaging that is integrated into Clario. So on this screen, the PRAs are able to easily see a list of the radiologists who are working and whether or not they're available or if they've stepped away. So it really enables them to be able to reach out to the radiologists. The PRAs and the radiologists exchange messages back and forth in real time, just as in a regular text message. And this feature also provides the ability to enter a phone number for each reading location, so it's easy to connect with a radiologist. We are looking and exploring an opportunity to use a new live chat feature. This feature would allow techs to submit a request through a chat option that would be available through their browser. This will eliminate the need for a phone call to the concierge service. So several key benefits to using this would include obtaining up to a 75% decrease in time spent by requesters, and primarily this applies to the techs. We could also get up to a 50% decrease in the time spent by the PRAs to handle calls. So their focus, instead of handling calls, would be working the live chat feature requests. And the goal is to do this while maintaining the expected turnaround times.
That's great, Laurie. Okay, thank you. And we're going to take another quick flash poll. We talked about using smart work list technology, also called a unified work list. So real quick in the chat box, yes or no, does your practice use smart work list technology? And if you have any questions about that, please type those in as well, and our staff will respond to you. Okay, so we're going to keep things going here. And one of the things that is really kind of been a secret sauce to this program is what we call the Rad Info Portal. And it's basically the nerve center of the concierge program. This is a secure, HIPAA compliant website that functions as a centralized knowledge center for all of the information that is needed for the radiology assistants, the technologist, the radiologists themselves. Everything lives in one central place, so that it can be accessed by people who have the permissions to see the various things that are needed to perform these services. So you can see some of the things. We obviously have telephone numbers. We've got different programs and products that the radiologists have to access. We have recent announcements in here. We have the help desk number if somebody needs to pick up the phone and call the service desk. We also keep the full contact database for all referring physicians. So, in the case of Cone Health and Greensboro Radiology, we've got a database of more than 1,000 referring physicians that we have all of their contact information and know how to get a hold of them if we need to. So if a radiologist says, hey, can you get this orthopedic surgeon on the phone because I need to ask him or her a question, then the techs don't have to say, well, I need that person's phone number, or all they have to do is say, yes, I've got it, and then they take off and go get that doc on the phone and then connect them to the radiologist when they're available. All the while, the radiologist can just keep reading and doing their work, and they're not having to deal with that. It's being handled in the background. So it's really important to build out this database of phone numbers and locations up front, because it'll save a ton of time later. We also have all the phone numbers for the different reading rooms and locations in case we have to call into the reading room. You can keep your clinical policies in here. Pretty much anything that you want to keep, you just put it in what we call the Rad Info Portal. You can build this with Google Docs, you can do it with SharePoint. There's a lot of different ways to do it, but obviously it needs to be secured properly and then credentialed only to people that should have access to it. And then the information inside of that portal needs to be kept current so that, you know, we don't have outdated contacts or phone numbers, et cetera. But that's a best practice that we recommend. So quick question, do you have a centralized knowledge center within your practice that has up-to-date contact numbers for every RAD and every location? We'll give you a moment to answer those via chat, and then we'll keep on going here. So all of this basically is designed to improve quality and ensure that we're able to get studies to the right radiologist at the right time. So for example, if in the same example that I just gave, if the orthopod needed to get a hold of an MSK radiologist, we could easily, the PRAs working the concierge desk could take that call and immediately see who's working today that's MSK in that facility. And perhaps in this example, it would be Dr. Bill Veazey, who's an MSK radiologist. So then they reach out to Dr. Veazey, connect them with a doctor or ask whatever the question is, and Dr. Veazey can answer it quickly. And that way we don't waste time trying to figure out who to get this message to. It just gets right to the proper person. We also want to talk about the results that have been proven out by this particular program. And again, we're just focusing on one case study. There are a lot of practices that have put in concierge programs like this. Maybe they call it something different, but the concept is the same. But the results that we've seen with Greensboro and Cone have been pretty exciting. This program was put in place several years ago, and we've continued to refine it, calibrate it, keep improving the service. And over time, we're taking more and more calls off of the reading room and the radiologist. So right now, on an annual basis, the PRAs in the call center are taking close to 83,000 calls off of the shoulders of the radiologist, and that includes inbound and outbound calls. The percentage of calls that are answered live is 98%. The average speed to answer those calls is 6.5 seconds. So generally speaking, someone is answering the call, whether it's coming from or to a radiologist, within 6.5 seconds, which is usually 1 to 2 rings, 24/7, someone's answering that call live. The average length of a call is 2 minutes and 9 seconds. And so the total time spent handling calls in the course of the year is almost 3,000 hours. That's a lot of hours that frees up the RADs to focus on other things. So now what does that look like in terms of an efficiency gain? Well, that almost 3,000 hours, 2,970, equates to 313 radiologist shifts. If you're assuming a 9.5 hour shift, which is that's the length of time that Greensboro uses for their shifts. 313 shifts relative to the size of their practice is the equivalent of 1.56 radiologists on a 200 shift per year schedule. And that results in a 2.1% efficiency gain. And it's important to note that this is just on phone calls alone. There are a lot of other things being done through the concierge service, but just on taking the outbound and inbound phone calls off of the RADs, we're creating a documented 2.1% efficiency gain. If you look at some of the other functions, the exam-related activities like comm notes and calling in critical results, maybe prefetching some studies or getting the hanging protocols right, things like that. When you add in the exam-related activities, we're generating another equivalency of a 2.2% of an efficiency gain, or 1.5 radiologists are being freed up. Now again, Greensboro's practice has 75 radiologists, so you kind of have to adjust this based on the size of your practice. But generally speaking, on a percentage basis, pound per pound, about a 2.1% productivity gain on calls and a 2.0% gain on the exam-related activities. Additionally, there are some efficiency gains from the Clario product itself, which we talked about earlier. Clario generally reports efficiency gains in the range of about 10%. We've seen some practices that have really worked on it and evolved it, have reported as high as a 15% efficiency gain just from the Clario Worklist product. For our purposes, for the purposes of the concierge service, we use 3% as a conservative estimate in terms of the benefit, the lift that it's giving to our radiologist. But the potential is certainly higher than this. So when you add all these together, we have a 4.1% efficiency gain from the calls and the comm nodes, and a 3% gain from the Clario Smart Worklist, which was a very conservative estimate. So when you put those together, it totals a 7.1% net efficiency gain. And that amounts to a little more than 40 minutes per 9.5-hour shift. Or if you run 9-hour shifts, it's about 39 minutes. So that's where we get our efficiency gains, and that's how we track it and document. Happy to kind of share some of these metrics and how we calculate it if anybody's interested in that. So we've talked about the case study between Greensboro and Cone Health. Let me share with you a few other just examples that we're aware of in the industry. A few of these we actually work with and kind of provide the concierge services. Some we don't. Steward Health is a large national health system. Steward has implemented this program for their radiology department. They're saving 97 hours per month on critical results reporting, about 11 minutes per report. Radiology Imaging Associates is a private practice in Florida. RIA saves 2.09 minutes per phone call by using the concierge service. Radiology Partners is obviously a very large national practice. Radiology Partners has their own concierge service, which they call the core team, and they are actually handling 11 million exams through this service for radiologists nationwide. And Renaissance Imaging Medical Associates, REMA, is based in Los Angeles. REMA has reported that they are reading 10% more studies each day because of having a command center like this with the tools that we're discussing here. So these are a few other examples in the marketplace. And it's also a good mixed bag of private equity backed versus private versus hospital and health system. So you can see that the results are pretty consistent and strong across the board. So let's take a moment and talk about the money side of this thing. When looking at the budget, obviously it's going to vary by practice based on your volumes, based on the scope of services that you're having the call center perform, also whether you're doing it just during daytime hours or whether it's 24/7. There's a lot of factors here. But generally speaking, if you're operating a 24/7 call center with some of the technologies that we've talked about here, you should expect to pay somewhere in the range of 50 cents to 95 cents per study. But again, this is a combination of technology and services. And when you compare that to the amount of time that you're able to free the rads up, the most expensive cost in your practice by far is a physician's time. So anything we can take off of the physician and have it done by administrative staff is going to provide a very significant return on investment. So, but roughly speaking, this is how you would calculate this. We also have an ROI model. If you're interested in, calculating this for yourself, we can share how we come up with these numbers. So next we'll talk about how to implement a concierge service. We've talked about what is it, and now we'll talk about how would you actually put one in place for your practice. This is something that, again, there's no secret sauce here. You can build one of these for yourselves, or you can outsource it to a service provider. Here at Canopy, we offer this on an outsourced basis to clients. We serve about 150 clients in 30 states, but you certainly don't have to use us for it. It's something you could put in yourself if you wanted to. But whether you outsource or whether you build it in-house, these are the steps that you would want to take to implement it. And I'll just try to hit these very quickly. Here's a quick checklist. Obviously, you need to have first of all, you need to commit to doing it and kind of count the cost and make sure that it's a program that'll work for your practice. Then you need to assign a project manager. You need to develop a statement of work. What is the scope? What are we trying to do? What's the time frame we want to have it live by? You've got to license and install the appropriate software, whether it's Clario or some other work list. You need to have a single work list product in place to really make this work effectively. And if you need to purchase any hardware or workstations or remote reading stations, you'll need to make those investments as well as your telephony. You've got to have your phone system. Really, it's the hub in the middle of this whole process. We encourage you to get a central toll-free phone line, and then figure out your staffing, determine your hours of coverage. How are you going to handle the nights and weekends? Again, as Laurie mentioned, we do the daytime hours, locally, and we do it in the U.S. We do the nights and weekends from the Philippines, from a healthcare centric call center that does a great job, and they speak really good English. So we've had a good experience with them. And then you have to recruit, hire, and train the professional radiology assistants that are going to staff this program and get them up to speed on the way your doctors work and their preferences so that they can serve them as well as possible. Additionally, you've got to determine your workflows and protocols. If you put in a program like this, it's probably going to require a lot of thought in terms of how you change your workflows. And you'll need radiologist involvement with that to make sure that it works in the way that's best for them. You also need to build your online knowledge base, the Rad Info Portal, as we call it. And whether you do that in SharePoint or, again, Google Docs or whatever you choose to use, you really want to build that out with the hours of coverage, all the location and physician phone numbers, technologist contact information, all the current workflows and protocols for things like code strokes, critical findings, downtimes, etc., making sure that everybody understands what your standards are and your protocols and your expectations. That all needs to go in the info portal. And then once you have all these things, there's just a lot of testing that has to happen before you actually turn it up live, and feel like you can do so with confidence. So we encourage you to just test before you go live. So in conclusion, a concierge program like this requires a significant investment of time and money. We don't want to pretend like it's not. It's a big change and a big investment. But once it's running, it'll provide huge benefits. It should pay for itself many times over for your organization. And most importantly, it will free up your radiologist to focus on the big rocks and being doctors first and foremost. So hopefully this has been an insightful session. We appreciate you all tuning in for it. And with the remaining time that we have, we'll just open it up for any questions. And Laurie and I will be responding to these questions via chat. So feel free to text us your questions, and we'll use this time to answer them. If we go over, feel free to email us directly. In fact, I'll go ahead and provide you with the contact information. You can just contact me. Again, my name is Reed, and you can just shoot me an email, and I'm happy to send you anything or have a conversation with you if you're interested in discussing this. But feel free to contact me directly. So we will pause and take some questions, and then at the conclusion of this, we would encourage you to complete the evaluation survey for this question. Let us know how we did. And I think that's pretty much it. So we'll pause now and look forward to your questions, and we'll just be responding via live chat. If you don't have any questions and you're ready to depart, please feel free to do so. Thank you for joining us, and we'll hang in there and answer any questions that the rest of the group may have. Thank you all again for your time. Hope it's been an informative session, and have a great day. Thank you.